This is your deep breathing exercise. You can sit on a chair, and I would prefer for you to sit more on the edge of the chair so we don't slouch. If you sit more on the edge, you can bring a little bit of curve, like by tilting your pelvis slightly forward, a little curve into your lumbar spine, and you will notice right away this will lift your rib cage a little bit and therefore increase your lung capacity. If you are a seasoned practitioner of yoga, you could also sit in a cross-legged seated position on the ground. These would be the best two options. So, while sitting upright, bring a little bit of effort into extending your spine towards the ceiling, just a little bit. Again, just not to slouch. For practice, place your hand onto the top of your rib cage and one hand onto your low belly. You can close your eyes or maybe keep them open so watch the video for a little while and then close them later. Try to breathe through your nose. So as you inhale, try to lift your rib cage up. So with your inhalation, you wish to lift your rib cage and you will notice that your hand is rising, and then as an exhale it comes back down. Alright, so that's for the first part. Now we want to add the part of the lower hand, where on the exhalation you will actively pull your low belly towards your spine. I always like to give the analogy of like you would walk into a very cold body of water and it starts to creep up onto your low belly. You're like, you're getting afraid of the cold water, and you tone the low belly from the bottom to the top. That would be most optimal. So let's just do this action for a little bit, just the lower body, maybe even both hands. So as you inhale, relax your low belly completely. Let it hang out. It's okay. And then when an exhale comes along, you pull your low belly towards your spine. Therefore, you will expel more air than you would normally do. Inhale, relax your low belly. Exhale, pull your low belly towards your spine. Go back and forth. And you want to, of course, follow here the pace of your own lung capacity. Sometimes in the beginning, releasing the belly and pulling the belly in on an exhale seems counterintuitive because we have trained ourselves to breathe only into our rib cage, especially as ladies, not being allowed to let the bellies hang out. So this may take some time, so be very gentle and very patient with yourself. Good, so now let's see if we can combine both. Place one hand back onto your chest, one hand onto the low belly. Remind yourself to sit up tall. A little curve in the lumbar spine. Extension through the crown of your head. Now close your eyes if possible. On an inhalation, lift your rib cage and let your low belly become loose. Exhale, pull your low belly in. Inhale, expand your chest, low belly becomes loose. Exhale, pull your low belly in fully. Inhale, the rib cage rises. The low belly releases. On an exhalation, pull the low belly in from the bottom to the top, if that makes any sense to you. Alright, so this is the technicality. Now let's see if we can actually put this into practice.